Hi, and welcome back to another episode of Coffee with Dr. K. I am Dr. Kendra Scott, pediatric physical therapist. Today, we're going to talk about some common movement challenges and when you should seek the help or assistance of a pediatric physical therapist or other pediatric healthcare provider to meet your child's needs. So, one of the most common movement challenges I see in my practice would be lack of head control and decreased neck strength. And what I mean by that is by about 2 months old, your little one should be able to lift his or her head enough in tummy time to clear his airway, meaning they should be able to clear their nose and their mouth and turn their head briefly and rest it on another side. When we don't see that at about 3 months old, when you're picking up your 3 or 4 month old and their head is still bobbing, or you put them in tummy time and they hate it, they can't lift it. They might rest their head on the side, but they hate it. They can't lift their head up. They can't change directions. This is one of the big signs that you need to seek the assistance of a professional so that that child can get the neck strength that he or she needs to function well. Another big sign that we see a common developmental delay would be a lack of reaching. So by about 3 months, your child should be able to reach. So not grasp. They won't be grasping yet, but they should be able to reach towards a toy and maybe just kind of bat it or tap it with their fist. Another common developmental delay or movement challenge that we see would be rolling. So rolling for your little one can start pretty early, especially in tummy time. In tummy time, at about 8 weeks, your little one will just take their head, move it over, and flip right onto their back. And that's more reflexive than it is purposeful. But purposeful rolling is going to start about 3 months old. They'll be on their back and they'll be able to roll into their side. Between 3 and 5 months, you should see this. And then between about 5 and 7 months, they should be able to roll purposefully from their back all the way onto their belly. This is a tough one, and I see this movement challenge a lot in my practice. And there are several ways to practice this. So if you're seeing even any of these challenges in your 6-month-old, your 7-month-old, they're still not rolling. Maybe they're sitting and they love to sit, but they still don't know how to roll. You definitely need to seek the assistance of a pediatric physical therapist or pediatric occupational therapist so that they can help you go back to the beginning phases of movement and work on those movement skills prior to more sitting. A happy sitter, which is what we call the little ones who like to sit but they still can't roll, is going to cause further delays down the line, because when that little one loses his or her balance, they're not going to be able to get into sitting on their own, and they're going to be frustrated. And then you're also going to start to see some delays with walking. And that brings me back to movement challenge number 4, delayed walking. So a lot of little ones are not walking by their first birthday, and that's okay. They should be close to walking though. You should be seeing signs of them walking prior to. And some of the signs would be them pulling up to furniture. If you've got an ottoman or a couch, they should be trying to pull up and stand to that furniture. You might see them cruising or walking sideways along that furniture. Those are precursors for walking. And by about 7 months, I want to say between 7 and 9 months, you should see those early walking signs pretty consistently. If you're not, then you definitely need to seek the guidance of a pediatric physical therapist. These are just 4 common movement struggles. There are many more. If you have any concerns about your little one's development, definitely reach out to a pediatric physical or occupational therapist. There's no need to delay. Don't delay. I want you to reach out as soon as possible because the health and the well-being of your child is so important. I hope you enjoyed this episode of Coffee with Dr. K. I look forward to seeing you guys on the next episode. Have a great day.